The Koala is easy to use following 3 simple steps: catheter insertion, monitor zeroing, and catheter to cable connection. Step 1 is catheter insertion. Open the Koala package by peeling apart the clear plastic cover from the back of the package to the line below the phrase "Peel to here." This exposes the inner pouch that covers the catheter, the pouch within a pouch concept that was one motivation for the Koala product name. This packaging design provides easy access to the Koala while ensuring the catheter remains in a sterile environment. Remove the catheter from the package and insert according to instructions and hospital protocol. Place the catheter introducer between the fingertips, and once the cervix is reached, advance the Koala through the introducer into the amniotic space. Be careful not to advance the introducer past the opening of the cervix. Remember, it is easiest to insert the Koala when it is disconnected from the reusable cable. Correct placement of the catheter should be within the amniotic space. Clinical studies have shown that IUPCs can be placed extraovular outside the amniotic membrane between the chorion and decidua of the endometrial lining as often as 30% of the time. This increases the potential risk for perforation, abruption via amnioinfusion, dampened waveforms, and elevated baseline readings. The Koala's clear catheter lumen and distinct measurement markings help the clinician confirm proper placement in the amniotic space. Insert the Koala up to the "Pause for flashback" marking, and then watch for amniotic fluid flowing back through the clear lumen. If the catheter is placed extraovular, a flashback of frank red blood, more distinct than blood-tinged amniotic fluid, may be observed. Remove the catheter and carefully replace it in another quadrant, pausing for amniotic fluid flashback as before. It is important to note that amniotic fluid that is slightly tainted with blood does not always mean that the catheter has been placed extraovular. A little blood in the catheter lumen may be normal. If no fluid of any kind flows down the clear lumen, pull the catheter back and place it in a different quadrant until amniotic fluid is seen in the clear lumen. After proper placement is confirmed, hold the catheter in place and remove the introducer. Step 2 is monitor zeroing. Zeroing is the process of establishing a zero reference relative to atmospheric pressure, from which intrauterine pressure monitoring is referenced. Zeroing is accomplished by pressing the zero switch on the fetal monitor while it is receiving an electrical signal from the transducer. The transducer is like a scale, with a voltage output offset that requires balancing when atmospheric pressure resides on the transducer. Pressing the monitor's zero button balances out this offset to establish a zero reference, so changes in intrauterine pressure can be accurately observed. A true zero reading is established only when the transducer is exposed to atmospheric pressure. Transducer-tipped catheters cannot establish a true zero in utero because the transducer is in the uterus and subject to intrauterine pressure. To compensate for this limitation, a switch is often installed on the cable or catheter to short the input wires so that a zero differential voltage is placed on the monitor input. This process of electronic zeroing does not ensure a true zero reading. If transducer-tipped catheter settings are inaccurate, or if the transducer has malfunctioned since production, then shorting the input wires may introduce an error into the pressure readings. The only way to have a true zero in utero is to have the transducer exposed to atmospheric pressure when the monitor is zeroed. Because its transducer is in the reusable cable rather than in the tip, the Koala calibrates to atmospheric pressure, balances out any offsets, and eliminates any potential zeroing error whenever it is disconnected from the cable. To zero the Koala pressure monitoring system, press the monitor's zero button while the catheter is disconnected from the reusable cable. The third and final step is the catheter to cable connection. Insert the catheter connector into the reusable cable. A distinct click will be heard and felt. The catheter is then locked into place. To remove the catheter, simply press the connector clip and separate the catheter and cable. To prevent catheter movement, attach the koala to the thigh of the patient using the adhesive patch. Remove the adhesive backing, pinch the patch around the koala, and place it on the inside of the patient's thigh as close to the introitus as possible. Another advantage to the koala's external transducer is that the clinician can disconnect the catheter from the reusable cable at any time after placement to instantly verify that the monitor, cable, and transducer are functioning and properly calibrated. This way, electrical concerns are eliminated from the clinical assessment.